everyone. Welcome to Recovery in Action. And we just want to thank you for joining us today. And I just wanted to let you know we have a very special guest with us today, and we're very pleased to have our good friend, Paula Maupin. She is actually our Fayette County nurse, and she has a lot of information that she's going to share with us today. And I just want to tell everyone that things that's going on in Connersville, things that we have hope. We have a lot of hope around here. We have a lot of people that are doing things out in the community, and we're just blessed, very blessed to have so many people that care in Fayette County. And I'm the director of the House of Ruth. I am Sharon Cranfield, as I said, and we just would like to. We have some very exciting news. The news is we are now actually certified by NR, and what that is Indiana Affiliate of Recovery Residences, and we are also registered in the National Affiliation of Recovery Residences. And this is a tremendous door opening for the House of Ruth, and we are very blessed, and we feel very honored to even be able to, it's been 7 years since we opened, and we just feel very, very blessed and honored to be a part of the community. And I love helping the women. I love, it's just my passion, and we are faith-based, and definitely we do a lot of praying and talking to the Lord, and I'm telling you, He is my strength, and He helps me a lot. And I just want you to know that when everything is going wrong, always know that He's a prayer away, and you just call on the name of Jesus, and He's right there with you. And I just want to let you know that there's hope. And one of the ladies in the house of Ruth, she's always talking, and she says, we want to offer hope, not dope. I said, that's a cute saying, but it's so true. There is so much going on in the community. There's meetings almost on a daily basis. And if you need help or any resources, there's so many places you can call. You're welcome to call the House of Ruth at any time. If I don't have the answer, I will find someone that does. Same way with Paula. If you have a question on resources, detox, anything that you need help with, the community is working together and doing the very best that we can to make sure that we can help people find out what they need, find the resources. And without further ado, I would like to welcome Paula, and thank you for being with us today.
It's a pleasure.
I was telling her as we were talking before we started taping, I said she was honored. Governor Holcomb actually had her to come to the State of the State address, and just share a little bit about that with us. That's a great honor.
It was really interesting. Got invited to represent the hard work that public health nurses and employees are doing to fight the opiate epidemic and try to help with overdoses. He spoke about that in his speech and welcomed me by name, which was really nice.
Yeah, what an honor.
Yes, got to sit up in the First Lady's balcony with several of his appointed people. I didn't realize it at the time. That's who they were, so I was kind of surprised chit-chatting with them. They were just average, normal people, and then realized who they were. But so that was really neat. And I got in the mail. I got a little bit later. I got a thank you, and it was on his a printout of his address.
Aw.
So that was really nice.
Absolutely. Well, you know what Paula works with and what she has in Fayette County, and there's a lot of different opinions on it, but she is very, very hardworking in the community, and she has actually been fundamental in getting the needle exchange program here. And I want her to just talk about the reason that we do it and the importance of why that we do it. And in And if you want to start with maybe 2015, maybe some of the statistics to kind of lead people into knowing, the reason behind, because it's all about public health. It's about
Right,
safety.
right.
It's about, our community.
Right.
So just take your liberty and just explain to us exactly what you do and why.
All right. In 2015, we started hearing about Scott County and the HIV outbreak that they had down there, and started noticing the how Fayette County is so similar to Scott County statistically. The population, their hepatitis C rate was very similar to what ours was in 2015. So we kept an eye on that. Then we got approached by the state and said, you have your hepatitis C rate is very high, one of the highest in the states, and they recommended that we pursue a needle exchange. So worked with the commissioners and Dr. White, our health officer, and got approved for that.
And that was a long time. I mean, you put a lot of work into
Yes.
that.
We got approved in August of 2015. We're not able to get up and running until November of that year because of funding.
Right.
There were no funds the county had to put into it at all. So we had some donations from the Indiana Recovery Alliance out of Bloomington. They gave us supplies enough to get started. Applied for some private corporate or company grants, private foundations, grants from them, and were awarded. So we were able to start getting supplies and things then. And started out in a trailer,
Yes.
big white trailer.
No heat.
No heat, no insulation. It was a
Yeah.
little cold. We got a generator big enough to support our heater, and huddled in front of it, in front of the old herb lumber. And understandably, people are skeptical,
Yes.
and nobody approached us. And then we switched to Smalley's and set up there for a little bit, and did have a couple of people come there. But started having more people showing up at our office. So we just discontinued the trailer and stayed with the office, and have 77 people signed up for the program to date.
And you have some success rates out of that,
Yes.
don't you?
I have a couple of people who keep in touch with me who are, one is 30 days sober, another is 5 or 6 months, and they keep in touch. And I have several people who are in treatment at the groups Recover Together in that program, which is really encouraging. And you were talking about hope. We chose to call it the Point of Hope harm reduction,
Okay.
because we want it to be a place where people can come to,
Absolutely.
and for encouragement. We started out as a public health to prevent the spreading of disease, but realized early on that there's a lot more to it
Oh, yeah.
than that. People need, especially people in the drug using community, they need encouragement. They
They need information.
absolutely.
They need knowledge. They're out there, and everyone, once you become addicted, and as well as I do, you're not in control anymore. It's
Right.
the drug that's controlling you, and sometimes they just need that person. Like you said, the two people that, are trying at this point. I mean, that's two people that you've reached. Just so that right there is, to me is monumental. If it's one person,
Right.
that's one more person and their family and their children and their, it goes so much beyond
Oh, it does.
just the addict.
Right.
So, but now on some of what is maybe some of the reasoning behind like the Hep C, because we were talking about that earlier also. A lot of people don't understand. They think, where you're just giving people, means of getting high. That's not what it's about.
No.
Just what is that health side of the Hep C and even HIV?
Right. Like what we give
Yes.
Okay.
Yes.
Everything that we give them it can somehow spread disease. So we give them the equipment that they need so they can use it personally for themselves. They don't have to share or use not sterile supplies.
Right.
Of course, the needles, we make sure everybody has enough needles to use one needle one time. They can come in. They may not necessarily feel comfortable bringing their needles in the very first time when they sign up. So we have a policy where we can give them up to 20, and then they will get what they return from then on. So they get
So you kind of give them a little sharps container that goes with it, and then
Right.
they return the needles with them. That way they're not on the street,
yes,
and they're not thrown in a trash can somewhere.
Right.
You know, where a child or someone can pick it up.
yes. We'll give them the needles. We have little vials of sterile water that we give them so they don't have to use, I've heard everything from Dr. Pepper to mud puddle water, whatever is available they'll use. So we make sure they have that, which not only helps with the spreading of HIV, hepatitis, because I've heard, and I didn't realize this till I started working the exchange, but people will set a cup of water in the middle of the table and have a group of their friends who they're shooting up with.
Right.
And everybody will rinse or draw up out of that cup. And they don't realize that sharing their equipment. Any one needle that goes in there,
It's already
you don't know whether it's
contaminated.
clean
Yeah.
or not. So everybody is exposed. So, and with the exception of the needles, people are encouraged to take as much of the other equipment as they want and offer it to their friends.
Right.
So we have the sterile water. We have cookers, little cookers, that we'll give them, because cookers are the second, except the needles, cookers are the second easiest way to spread hepatitis C.
Because of the sharing. Yeah.
Sharing that. We make sure they have alcohol wipes and use those every single time. It just cuts down on inflamed veins and any kind of infections, abscesses, things like that. People don't realize how common heart infections are
Oh, yeah.
with drug users.
I think it's endocarditis and that way. Yeah. And that's deadly.
It is.
I mean, that's deadly.
Yes, very much so. Tourniquets, we'll give them the tie-offs, because that's a really, really easy way. You know, your work, when you shoot up, you're shooting into a blood supply.
Right.
So if that tourniquet gets blood on it, then you offer it to your friend, then that's, just a really good way
Yeah. Passing
to
it
spread
on.
it.
Yeah.
We have a lot of wound supplies for people, antibiotic ointment, handy wipes. Trying to think.
So I guess that's where people don't have the understanding. I mean, it's not just that you are handing them needles, because
Right.
I think a lot of people has the misconception of actually what you're doing. It's about the health. It's not,
Right.
because I mean, that's like MRSA, when they get really bad sores or, abscesses like you were talking about. I mean, people don't realize, that is so highly contagious.
It is.
And I mean, if they're in your house or they're around their children or anything, I mean, that is so, and this, you are helping with the means of trying to help stop those kind of contaminations of being
Right.
spread.
And everyone, it's not, people don't come in, say, I want needles. I don't give them
Right.
needles, say, there you go.
Right.
I explain each item that I'm giving them and explain to them how it prevents the spread of disease. Give them the syringes, explain that they have to bring them back to me in order to get more. We offer treatment to everybody that comes in. Let them know that we're available to make referrals for them.
See, that's wonderful.
We are also able to do presumptive eligibility for HIP 2.0 insurance, and then hook them up with someone at a navigator at the hospital to complete the process if they need it. And this is, it's encouragement every single time. Every time a person comes in, it's another opportunity to have a positive influence on them, offering encouragement and build them up a little bit,
Yeah.
because most of the people that come in are beat down and
Oh, yeah.
have no self-worth. They just are,
Yeah.
feeling really low, and it just takes a long time to talk them into believing again that
That
they
you
are
wanna
worth
help.
it, and that
You're
that's what we're
truly
here
there.
for.
Yeah. Yeah. It's
And
not a setup. You
no,
really
yeah,
want
I'm
to
not-
help them.
It's
We're not-
anonymous. I don't know names. I don't have to know names. I don't even have to know I have to collect four letters of your name, 2 from your first name, 2 from your last name, and a birthday. I have no idea whether you give me the right letters or
Right.
the right birthday. I just need something to put on that card.
Right.
Because when people come in, the information that they give me as far as initials and their birthday goes into the computer, and it generates an ID number that I put on a card, and they carry the card with them that identifies that they're in the program. And it's, even though it's still against the law to carry needles,
Right.
if you have your card and you have your equipment, you have your dirty needles in the correct spot, it's up to the officer's discretion whether they cut you a break or not. But it's
Right. Because it is illegal.
Right.
I mean, to use drugs.
and
So.
it is showing an effort on their part that they're trying to stay well and get help. So, and there have been instances where people have gotten a break.
Oh, yeah. And one thing too, you were talking about the encouragement, but I think it's building a trust with you also, because there will be a lot of people that would come to you now knowing that you are there versus someone that has no idea what they're going through. Maybe, and maybe they would get an abscess, maybe they would get an infection, that they may come to you and say, Paula, I don't know where to go.
Right.
You know that I come here, and it's one of those things. It builds more than just encouragement, and I think that's what they need. Lots of times they've lost everything else anyway. Like you said, their pride, their self-esteem, everything about them has been beat down, and usually they've lost their kids, they've lost their home, their job, for whatever reason, and it's one of those things. When you have someone there saying, listen, I can help you get on insurance. I can help you get into detox. We'll find you a facility, to help you. I mean, that means a lot to people. Sometimes it's not a handout; they want a hand up.
Right.
Just someone to say, and you're that encouraging word. And that's great.
I try.
Yeah, but you do a good job. You do a good job. I mean, being recognized by the governor and the county and stuff. I mean, people, and you've been consistent with it, and that's what we need. I mean, everybody working together. I can't do
Right.
it on the hill by myself. You can't do it down there by yourself. The court's not going to do it all by themselves. It takes us all collaborating together, working
Yes.
as a force to try to battle this epidemic. And it takes, like you said, one person at a time. Just one
Right.
person at a time.
Yep.
And I'm there. I'm there.
Another
So-
thing that we have started offering is Narcan. I didn't think
Okay.
about that. Yeah, or naloxone, either one. I've used some of the grant funds and gotten a grant, an opiate overdose grant from the state.
Okay.
And they've provided doses of Narcan.
Now, do you train people?
So everyone that comes in, if they ask for it, sit down and explain how it's used. In order to fulfill the state's guidelines, I have to offer treatment, explain to them how it's used, and instruct them in the event of an overdose and they have to use that Narcan, they need to call 911.
Right.
That's
absolutely.
It's so important
yeah.
that they
Now,
do that.
is it the nasal or is it the EpiPen?
I have the nasal, and I also have an injection.
Yeah.
Well, I'm out of it now, but
Right.
for that goes intramuscular.
Right.
Mostly, I have the intranasal though.
Yeah. Now, have you had to use that?
I have
Or
not.
are you
No.
good? Good.
Before we started carrying it, I had an opportunity where I could have, but didn't have it available then.
Yeah. So, so can that be for the families, or is that the people that come in? For the
Anyone.
needle exchange. So if someone knows that their child is using, they can come in and you can train them.
Right.
Because there are parents that have found their children.
I've had
It's
several
sad to
family
say.
members that
Yes.
come in and get it for their
Yes.
spouse or their
Yeah.
child.
And it can save their life. But like
And,
you said, having the training, of course, knowledge is the key. Having that training is definitely
Yes.
what they want to do, so they know how to use it.
Right.
And that's great. That's great. So do they just contact you there? Do you do the training there? Is it like 5-10 minutes?
Yeah.
Oh, okay. So it's
a
not
really
like
quick thing. I just go through I have a checklist, go through that, make sure I feel like they understand what they need to do, and then
That's wonderful.
we'll give it to them.
So are you going to be up at the Dribble Over Drugs?
I'm going to
you?
be there for a little bit. It's my
Yeah.
anniversary, so
Oh, well, happy anniversary.
thank you. Have to spend
good.
time with him.
Yes. But I think what is so tremendous about, Fayette County right now, and this is, I do believe we're all on the same page, that it's,
I do.
prevention, education, awareness. I mean, that's what we have to do. We can't stop.
No.
The drug addiction, the epidemic, whatever they want to call it, is not going away.
It isn't.
And we have to stay strong and diligent in what we're doing to make sure that every person that we can help, that we get help
Right.
for them. We may not have, every facility here in Connersville, but I'm like you, we can find resources. We will find a place. We will, I've sent people as far away as Tennessee, Kentucky. I mean, it doesn't have to be here. If they're willing to go, we'll find them a place. And that's the main thing. And there's different treatments. There's different, everyone has, different needs. Their families have different needs. And it's one of those things, just everybody just working together, trying to fulfill, those needs.
Right.
So you were talking about you have 77 people on the needle exchange now. Okay, good.
Yep.
That's great. And what else do you do down at the Fayette County Health Department? I mean, it's pretty open to anyone in Fayette County, right? For any of their needs. I mean, because
Yeah.
I know a lot of people are like, what do they do down there?
We do
So-
a lot of education.
Yes.
Immunizations. Do a lot of those, and we have infant, school-age kids, adults. We're able to help all those ages. The state did require that we get credentialed to bill insurance. So that's, if people have insurance, then we have to collect that information and bill their insurance. As several years ago, it was just opened.
Oh, yeah. There
We
was
got
no
vaccine from the
charge, yeah.
CDC through the
Yeah.
state health department, and there were not a whole lot of guidelines that we were really forced to follow. And so we could pretty much offer to anyone, and then the CDC kind of started really enforcing
Yeah.
the rules.
Yeah.
So,
Darn those rules.
but the good news is most insurances cover completely for prevention, and
Yes.
vaccines are prevention. So most of the time, it's 100% covered. And we still are able to offer the state vaccine free of charge to anyone who doesn't have insurance. So
See, that's awesome, because there's a lot of people that fall through the cracks sometimes. And at least they have that information that they know they can come down there, or at least call. And, and like you said, you
Right.
can even hook them up with insurance. I know I send a lot of people to Trish at the hospital.
Yeah.
She's great.
She is.
She's wonderful to work with.
She's a miracle worker.
She is. If you need insurance, you need to go there.
Yes.
But she's phenomenal and stuff like that. And in today's, society, I mean, insurance, most children should qualify to have insurance. And like you said, if they don't, I mean, they can come down there and get their immunizations and, not get behind, before school.
Right.
And that's always something,
Yes.
Now, what hours are you open? Are you open every day? Or what
Yeah,
is
our-
the needle exchange? What
The
hours
needle
are
exchange
those?
is Tuesdays and Thursdays from 9 to 12.
Okay.
And on most Tuesdays, we have the girls from the groups Recover Together come and hang out and are available to talk to people if they're interested. And then on most Thursdays, I have a volunteer counselor that comes in,
An addiction counselor.
comes in, hangs out with me, and they both have been very beneficial.
Okay, well, that's great.
It is.
And then the other hours?
For the health department, we're open from 8:30 until 12 and 1 to 4.
Okay, every
Monday
day?
through Friday.
Monday through Friday. Yeah.
Yep,
Well, you guys stay pretty busy, I'm sure.
we do.
That's wonderful, though.
Yes.
So I know that there's a lot of people, if you have any questions, just like we've been talking about, I know, do you have literature and stuff that people can pick up?
Yep, we have brochures. I have a pamphlet on the needle exchange if anybody's interested. And I would encourage anybody to give me a call. If you have questions or you just want to see a little more in detail about what we do down there, call me. Mondays and Fridays are good days. If they wanted to stop in, we can make arrangements for them to come in, and I would walk them through it, show them what we do, what we offer,
Yeah.
and
I think people, like we were saying, I think they have a misconception of what it's all about.
right.
And, once they see, it's not, it's preventive.
It is.
It's
I'm
definitely
not
preventive.
by no means encouraging people to use.
Oh, absolutely.
And a lot of the people that I have in the program have really cut back on the amount of times they inject a day. They're cutting back on their use.
So the education and the knowledge is working,
It is.
Yes. And I think that's the biggest key is, and like we were just saying, it's prevention, awareness, the education. You're down there and you're educating them as well as helping them prevent, the spread of disease. And I, sometimes I don't think they even realize, they don't, at the point of their addiction, they don't even care.
No.
And then when you're there saying, look, I just don't want you to get sick. I don't want you to, it's one of those things people, there's a reason for it. There's a rhyme to the madness,
Right.
It's
Yep.
like, we don't always, understand. And when the needle exchange first came, I was like, are you kidding me?
Well, when the thing at Scott County was happening, I would hear that they were getting ready to start their needle exchange, and I, in my own mind, thought, oh, heck no.
I think a lot of
not
us
doing
did. It was
that.
like, are you crazy?
But the more you read about it, harm
Yeah.
reduction, and
yeah.
the more sense it makes, because like you said, this isn't going away.
No.
It's not.
No. And this is just another preventive health, for the community, preventive measure for it. And the last statistic I heard, Fayette County is still number 1 in overdoses. Are we still?
Yes.
Yeah. And even now, I mean, we, and so that just goes to show you that the statistics has not changed that much.
No,
So.
it's not. The only thing that maybe have changed, I've noticed is the amount of actual overdose deaths.
Deaths, yes.
It's down quite a bit. Last year was a record year
Oh, yeah,
for deaths,
yes.
and it's substantially down this year. And I think that has a lot to do with the police department.
Drug
carrying-
task force, yes, for
Right.
sure. Well, Paula, this has been wonderful. I've enjoyed you coming so much.
too.
And,
Thanks for
and just
having
for
me.
this, all this information that we wouldn't normally have. You know, we just really appreciate everything that you're doing. Everything
you.
that you're doing. You're in our prayers.
Thank you.
And thank you for joining us today. Have a great day and see you next month.